Hello, I'm urologist Omer Erdem. Today we will make a short video presentation on what can be done at home for premature ejaculation. It is necessary to separate first whether premature ejaculation is due to erectile dysfunction or from lack of knowledge and experience. Because if premature ejaculation is caused by erectile dysfunction, it is unlikely to be successful with home exercises. There are also certain parameters of premature ejaculation. These include the frequency of sexual intercourse, the nature of the relationship, and the sexual position. For example, if the frequency of sexual intercourse is 3 or 5 times a month, it is very difficult for people to overcome premature ejaculation. Dryness of the vagina, shortness of breath during intercourse, or sweating blood can also be reasons for premature ejaculation. One of the most important points is also whether the female partner supports the man. If the female partner says that he has to solve the problem by himself, it is very difficult to overcome premature ejaculation because it is very difficult to deal with it alone. If there is no problem with this, what exercises can be done at home? Kegel exercise, start-stop, head tightening method, yellow light method, and breathing exercises. Let's explain these briefly. In the Kegel exercise, you learn to squeeze or relax the muscles around the base of the hips, which is the anus, and around the base of the penis whenever you want. And during intercourse, you learn to keep those hip muscles and the muscles surrounding the penis loose. You can see it below with a video I linked to. In the video, it shows how the patient can easily learn this with the help of the biofeedback device. There is also the breathing exercise, the start-stop exercise, and the penis head squeezing exercise, and the logic is the same for all of them. The person inhales deeply through the mouth 3 or 5 times and exhales slowly through the nose as soon as he thinks about ejaculation during intercourse, which causes changes in parasympathetic activation. Likewise, at the start and stop, the person will reduce the level of pleasure and will stop himself when he first thought about ejaculation. In the method of squeezing the head, he pulls out his penis when he thinks of it and squeezes the head of the penis between his thumb and forefinger. If he wants, he can also touch it with the cold water bag, which lowers the pleasure level very quickly. With the yellow traffic light method, you imagine the yellow traffic light as soon as you are about to ejaculate, and the traffic sign triggers the stop reflex in your body because it means stop. The exercises here are actually the same. When the patient takes out his penis, he can change his position. If he takes at least 3 or 5 different positions during intercourse, the duration of intercourse will increase. Also, he can say a nice word to his partner, because many people say, when I take out the penis, it makes my partner uncomfortable. In this case, it is especially important that the female partner supports him. So, how can I help you here? The difference between premature ejaculation and erectile dysfunction should be very well known. I can help you with this. I can help you with counseling. Thank you for listening, with all due respect.